All right, here we are with the last set of content before we get to the second midterm. So again, do remember that midterm is going to be on Friday, April 3rd. You will access it via Canvas. Let me know if you have any questions or issues with this, and we'll, work through it together. Okay, so this is, again, the last bit of content we're going to go through in our journey through non-experimental designs. We're going to cover these last two today. We're going to talk about single case designs, which are, sort of combining case studies with some of our types of quasi-experiments in a way. And then we'll talk a bit about developmental designs. Good God. Some random call that I'm getting, and I didn't silence my phone, obviously. Apologies for that. Okay. Anyway, I'm just gonna not edit that out, and this will be fun for you to laugh at me at this point. Neat. Okay, so we are gonna wrap up talking about those developmental designs, which are looking at things longitudinally generally, but there are kind of cross-sectional ways of doing that. But we'll get to that in just a bit. Okay. So I think in order to talk about single case designs, it makes sense to just review real quickly some of the aspects of case studies that we talked about recently. Remember that case studies are kind of deep dives into the history of usually a single person, sometimes a single situation, and it's usually done in order to look very carefully at something that's maybe uncommon. So somebody with a particular mental illness or malady, somebody with a brain injury that is rare and you can't replicate, you might use these things to study some circumstance that you wouldn't be able to necessarily find very easily, and definitely wouldn't be able to manipulate in any meaningful way. But we also talked about some big problems with case studies, right? That when you have a sample size of 1, your external validity is very limited. In a sense, you should not generalize at all beyond a single case, but they often give us kind of useful starting points for things. They also, introduced the possibility of researcher bias. We talked about things like, Freud being very unethical and extrapolating things in a crazy way from notes that he took and injecting, sort of a self-aggrandizing way of interpreting the things that he said he observed there. So when you only have one bit of data and you're not aggregating it, it can be difficult to rule out the possibility that a researcher is intentionally or unintentionally changing things about that. Because case studies are on uncommon participants, it might be very difficult or impossible to replicate because you can't find somebody with that same brain injury or can't find somebody with that same type of disorder. So this is problematic there, obviously. And finally, there isn't really much internal validity at all with a case study because you have no control over any of the variables that are introduced. They're all just presented as they've unfolded in this person's life, so you really have very little control at all with this. So single case studies that we're going to talk about in general are sort of combining case studies. They're using these types of people or situations that are rare, and they're adding a little bit of control. Not a lot, but they're adding, more than zero, basically. So single case studies, in another way, we might call them single case quote unquote experimental designs. Because they're not really experimental, but they're kind of mimicking the logic of an experimental design. You're instituting some kind of control by manipulating a variable. But like we talked about with those different quasi-experimental designs, when you're introducing a treatment, it might be problematic to conclude that it's the only thing going on, right? We have those issues of history and maturation, instrumentation, and those things are still going to be issues here in single case designs, but I'm not going to harp on them quite as much because we, just covered those things. Some historical examples of single case designs, before we knew that much about sampling, and psychologists were, basically just philosophers that were interested in things like memory and experience. A lot of the studies that constitute the beginning of psychology were single case designs, where Hermann Ebbinghaus, for example, an early memory researcher, did studies that were basically on him or single participants that he would be able to get into his nascent lab there and do studies on memory, like having people try to remember strings of nonsense letters and seeing how that compared to something like remembering short words, right? So he's manipulating whether the words are nonsense or real words, or the strings of letters are nonsense or real words, and seeing how that affects memory in a particular person over many, many trials, and in himself in his early trials. So he is using very small groups of one, essentially, to manipulate a variable. Another kind of famous example would be Pavlov's studies that kind of led to our modern understanding of what learning and conditioning are like, where he was pairing the presentation of food with the sound of a metronome for dogs. Pavlov, you might know, wasn't really a psychologist initially. He was a physiological researcher studying digestion, so he was interested in saliva. So he was seeing how saliva played into digestion by studying saliva and digestion in dogs. But he would use single trials as evidence eventually for how conditioning worked. So these were, some early historical examples from the late 1800s and early to mid 1900s. So, just to give you an idea, these are not unheard of, but they are kind of rudimentary and characterize a lot of early psychology. But we still might use these designs today under certain circumstances because there might be something unique about the people involved, the behavior that we're looking at, or the idea that if you can find a single piece of counter evidence to something, that might refute a theory. Like, if you are trying to show that, maybe let's say the biases between liberals and conservatives don't always function in the same way. Maybe you are showing a case where you can manipulate the empathy of a conservative towards some sort of marginalized groups to make them more empathetic. That might show that somebody's theory about conservatives not being empathetic is wrong, because you can put conditions in such a way that they do act in an empathetic way. So, we need lots and lots of evidence to build up to really support a theory, and we might never want to say that we proved it. But sometimes if you can find a single instance where you refute a theory, that's enough to discredit it or at least put a lot of doubt on it. So it can be a use of a single case study that demonstrates something without collecting more data than you need necessarily. Or, maybe a more appropriate example might be if we think that you absolutely need the amygdala to experience any emotion, and somebody had a damaged amygdala and they still experience emotion, well, it seems that maybe the amygdala is not quite as central to emotion as we thought. Maybe it still plays a big role, but other parts of the brain can sometimes compensate for each other, and maybe showing that somebody without an amygdala can still experience emotion. My understanding of neuropsychology is limited, we'll say. And as I say that out loud, I'm pretty sure that if you didn't have an amygdala, you would not be able to survive. But my example, just take it as hypothetical, obviously. Another reason we might use single case designs, in addition to all these particular things, that you can't get enough brain injury patients in a particular way, or you're trying to refute a theory, or some type of protest behavior might not happen all that often. It is just expensive to do lots of types of research, different things, particularly ones that have like physiological types of measures or involve surgeries or something. They're just too expensive. So it might be the case that before you do bigger experiments, you want kind of a proof of concept with single case designs, or you maybe just literally can't do anything besides single participants because of how rare people are. So there might be lots of reasons that even though these designs have their issues, we might still engage in them. Okay, so let's talk about a few different types of single case, quote, experimental, unquote, designs. The way that we're going to talk about these is kind of the same way we talked about counterbalancing, like an A-B design might be just that you have a baseline and then a treatment, where we talked about A-B-B-A designs, like baseline, treatment, treatment, baseline, but we'll come back to that in just a minute. So an A-B design, what researchers mean is there is a baseline that's like a control, and there's a treatment that is the measurement after you've done whatever your experimental condition is. So an A-B design might look something like this, where you have your baseline measurements near the beginning, or at the beginning, before you've instituted some kind of treatment, and once you put your treatment into effect, then you continue measuring things, and you can show that something has changed, that the frequency of responses has dropped. Like maybe people are overeating less because you instituted some type of therapeutic treatment to get them over their binge eating or something like that. This should look pretty familiar. It looks, I would imagine, just like our interrupted time series designs, right? That you're getting some kind of baseline, you're instituting a treatment, and then you're measuring things after that treatment. The big difference, obviously, is that you're doing this with one person in this scenario as compared to trying to do it with a group of participants. So what you're trying to do here is say, well, we know what a baseline is like, we've instituted something, and we can see now that our treatment had a result. So people are trying to use these to infer causality, but we know from all the other things we've talked about in this class that this is a pretty weak way to do it. You might have some confidence that this is stable and this is stable, and your treatment was intervening, so led to this difference. But there are lots of other explanations like history, maturation, instrumentation, regression to the mean. There are lots of reasons that your internal validity might be kind of weak here. So there might be other ways that we want to manipulate things to make this a little more rigorous. The next level up is something called a reversal design, where you're basically reversing your treatment, otherwise sometimes called an ABA design, because you're doing baseline, treatment, and then back to baseline. So these are really only useful when you have a treatment that's kind of reversible. Sometimes, like let's say a surgery to remove part of the brain, that's not going to be reversible. But if it's something like somebody's doing mindfulness training that, if you stop doing it, it stops working, then it might be something that you can change. So just how it sounds, you do a baseline, you give a treatment, you do a post-test, and get another baseline. So it might look something like this, that you have your, let's say, stick with binge eating episodes, you have a treatment where you are getting therapy. Wow, I'd say that's the weirdest pronunciation I've had so far, but we're only about halfway through things here. You get your therapy that reduces those instances of binge eating, and then you remove the treatment and you see that the instances go back up. Obviously, this might have some ethical considerations because you don't want to take away a treatment that's working, but it's also maybe the only way you can tell if it's working. So here you might have stronger evidence to say, well, the binge eating only receded when the treatment was present. So this can be pretty useful, but we also know that maybe this has to do with like a placebo effect, or we can't rule out other things like history and instrumentation going on here necessarily either. There could be some kind of coincidence going on. So another level of rigor to kind of show that this is not a fluke, this baseline measurement, is to do what is still referred to as a reversal design. It's just another version of a reversal design to do not just AB, not just ABA, but ABAB design, where you are doing the baseline and treatment both twice. So binge eating's up, you give a treatment and it reduces. You take the treatment away, binge eating comes back up, you give the treatment back, and it reduces again. So this is, a good way to think about how we might infer causality in a single case with a little more rigor. Again, this isn't the strongest way to infer causality, right? Because we're still just using one person. We're still subject to, coincidence, problems like history, maturation, all these different types of things that, we might not be able to explain perfectly. But obviously, this does seem like relatively strong evidence that these things are related, that these therapies do have some kind of meaningful outcome here. So those are, pretty much the vanilla types of single case designs. Sometimes people, though, might have a slightly more rigorous way of doing this where instead of just looking at one outcome, like here, we're just looking at binge eating episodes. Maybe there are other things that are related behaviors that we want to look at. So multiple baseline designs are basically just doing multiple single case designs, where you are looking across different situations, across single participants, or across different types of behaviors. And this might show you that you see changes across these different contexts when a treatment is introduced. So showing basically that your changes replicate across different subjects, situations, or behaviors. So one example of this might be when you do single case designs for a few different participants. Now, why would you do this? Well, it might be the case that you, instead of trying to pool these three participants together, you don't really get that much statistical power from one person versus three people. So maybe it's more useful just to look at the individual changes among three different people separately. So in this one, kind of a silly example where there's maybe like some training to get basketball players to take higher percentage shots that they're more likely to make rather than taking more difficult, like 3-point shots all the time, just trying to get players to be more like careful and responsible, I guess, in a sense. When maybe you're introducing the treatment at different stages to these different people to see if it is actually the result of them, or if it is actually the reason they're getting better. So you look at Beth, Carol, and Ariane, and you see that Beth does seem to get markedly better after the treatment, but when the treatment comes for Carol and Ariane, they've already started to get better. So this might help you pull apart the idea that for Beth, what you're observing here is probably just like maturation, that over 6 practice sessions, she didn't have that much improvement, and around the 6th or 7th practice session, that's where basketball players start to realize that they need to take more high percentage shots. So the treatment for her looked like it worked. But if you compare that to Carol and Ariane, you'd see that that's where people started to get better anyway. So their curve is a little flatter, so maybe it just takes a little time, but they all end up in the same spot. And Beth's treatment maybe like made it go faster, but it didn't really change what you observe. So again, this is a lot of like inference that you're making without a ton of strong statistical evidence, but it's also useful to think about these trends across different people. To look at a multiple baseline design across behaviors, the example I have up here is about people getting social skills training to be more assertive in general. I know it's kind of hard to read here, but I have a ratio of eye contact to speech for one behavior, the loudness of speech, the number of requests somebody makes, and then some overall assertiveness score, maybe like judged by impartial judges or something. So this might be used to, implement a treatment at different stages to see if it boosts these different types of different behaviors across the same person, and then kind of a break here and a follow-up to see if they remained. So you might notice the treatment has a really big effect on the ratio of the ratio of eye contact to speech. Has a maybe delayed effect on the loudness of speech, has a smaller and slightly delayed effect on the number of requests, has a really seemingly delayed effect on their overall assertiveness, maybe because these other things are accumulating and these other indicators of assertiveness are finally being like noticed by the participant or something, and they jump up here toward the end. So again, if you can replicate these different results across a bunch of different indicators of something like assertiveness, maybe this is better evidence than just showing that, hey, people's eye contact increased from the social skills training. Well, you could say, well, not only did their eye contact increase, but they talked louder, they made numbers of direct requests that were increasing, and they seemed more assertive to judges. And then this isn't really part of this, but just to mention that if you have a gap in your measurement and you show that things last, that's also good evidence rather than, what if you came back at a follow-up and things were back to baseline, right? So you can show these things last if you follow up with people. Okay, so we've talked about across different subjects, across different related behaviors for one, let's say, client or patient. Or you might also, look at a particular type of behavior in a group setting, like across different situations. So, you could do this with an individual participant too, but the example I have here is at a school where there are lots of problematic behaviors, students getting in fights and stuff, and they're counting these across different times in the school day. So when students are entering school, when students are entering the cafeteria, and when students are exiting school, and there's some sort of intervention that the school has implemented to reduce these types of behaviors. So if you just had entering school and you had this intervention that seemed to change things, like, wow, we have way fewer problem behaviors when people are entering school after this intervention, it must be working. Well, it might be, but it's nice to have multiple indicators of that. Well, there are also problem behaviors when they're entering the cafeteria, which fluctuates a lot more, and, it seems a little bit lower, but not markedly so in the same way it did for entering school. And exiting school, we seem to see like kind of a downward trend anyway, and then there's a little bit of a difference. So, if you only had this evidence, you would be really convinced that your intervention reduced problem behaviors in your school. But if you look at these other indicators, maybe there's a little more reason for skepticism, and you wouldn't want to necessarily implement this on like a national level or something, just based on this evidence. So again, this is taking the single case example and applying it to the unit of a school rather than the unit of a person, but I think still a pretty useful example here. Excuse me. So single case designs are obviously not perfect. The things that I mentioned for those multiple baselines, they don't necessarily control for contamination, meaning like in the basketball example that I used here, maybe the treatment did matter, and it's that Beth learned from the treatment and she taught it to Carol and Ariane. Or maybe it's the treatment didn't matter and everybody's getting better after the 6th or 7th practice. It's really hard to tease those things apart. They're pretty much observationally equivalent, so you don't necessarily have the strongest evidence either way. You also, across like any type of single case design, you can't reduce observer bias completely, especially, we talk about this with general experiments too, but if you only have one person you're observing, then it might really be the case that dealing with one person really amplifies the types of bias that you're seeing. It also might be the case if people are really the only focus of a study, things like reactivity might be even more pronounced than usual. So just by being observed, that affects people's behavior, and they might have, expectations about how they're supposed to be acting, or it might just be kind of weird to be part of a study, or even in the school example, like students knowing that their behaviors and acting out behaviors are being recorded might affect them. So just being studied might lead to these different types of effects, even more so in single case designs than in bigger experiments. And of course, it's really important to remember that just like case studies, using these single types of designs are not very representative at all, right? You're still using a sample size of one. They're maybe best to demonstrate like that something is possible. or to show that a theory has a hole in it, rather than being like the end-all, be-all evidence for something, right? That they might not be the most representative no matter what. But it's also important to remember that, we've talked about the limitations of experiments, like true experiments with big sample sizes too, right? That any design that we choose is going to have trade-offs. Single case designs are good when you have limitations like, time and funding and the number of people you can get, and you really want to observe something at a close level. They might be the best choice. Experiments might not always be the most appropriate, even though they are the things that help us the most with causal inference, basically. Okay, so to wrap up this section of content, I want to talk just a bit about one last type of non-experimental design, a developmental design. Developmental designs are used, not just by developmental psychologists, but by anybody that wants to look at changes over time. It is looking at things as people age, basically, over the life cycle. They don't include random assignment generally, although you can mix developmental designs and experiments. But usually they are basically just correlational studies, kind of looking at changes related with age. And in general, you're probably already familiar with these terms to some degree, but you could do developmental designs in a few different ways, cross-sectionally or longitudinally. Cross-sectional designs are where you just take cross-sections, subsamples of people from different ages, and compare those subsections. So you have different participants in each age group. And this is really good because it is fast, cheap, and relatively easy. So let's imagine you want to look at age differences in attitudes toward social welfare programs or something. So you get a sample of 1,000 20-year-olds, 1,000, let's say 20 to 30-year-olds, 1,000 30 to 40-year-olds, 1,000 40 to 50-year-olds, and so on. So you have all these cross-sectional cohorts of people, and you compare these differences in age groups on their attitudes toward social welfare programs. So you can make these comparisons fast. You can do it all at once. You don't have to wait for people to age, and you can see these age-related differences. But obviously, these have their limitations, that you're not always going to be able to rule out alternative explanations. You can't really look at cause and effect and say, look, we see that social welfare programs have more support among younger participants than older participants. So it might not be the case that it's really because of aging, though, because, people were born at different times. It might be that people born in the 1950s just don't like social welfare programs in general because they've never benefited from them directly. And there are groups that they see as rival groups or something that have benefited from them, like younger people that they think didn't earn their support from the government or something. So you can't always say in these cross-sectional designs that something is really due from aging. You're just looking at differences between cohorts and generations. And what I mean by cohort, just in case you're not aware, a cohort is just a group of people born at the same time. So everybody born in the 40s is a different cohort from people born in the 50s and so on. I mean, the cutoffs are arbitrary, but you see what I mean. So cohort effects might be effects due to the unique experiences of a generation rather than just being of a particular age. So, people that were teenagers during the Vietnam War had different experiences than people that were teenagers in the 1990s. And they had different experiences than people that are teenagers now, right? So age might interact with different historical types of experiences, but don't really let us say that anything is necessarily just about aging. Okay, so if cross-sectional designs have all of these limitations, what can we do? Well, one alternative is a longitudinal design, where you follow the same participants over a period of time. So by using multiple measurements over a period of time, you can infer causality by doing different types of panel analyses, basically. That if you have enough measurements, you can use some statistical techniques to really infer causality in a strong way with things like random intersect cross-lag panel models and things like that that are kind of beyond the scope of this class. So when you have a group that you're following over time, cohort effects are not influencing you in the same way because you're just following one cohort. Maybe you have 1,000 people that were born between 1965 and 1970, and you're following them for 30 years or something. So cohort effects don't matter because you are following the same people. You're not comparing different cohorts. But because you're only following one group of people, it might not be terribly representative because you might have like a weird group of people, right? The people, again, born in the 20s are different from the people born in the 60s or different from the people born in the 1990s, right? So following any one of them might be unique to that particular group. So these cross-generational effects are what I was just describing, that just because you've done a longitudinal design with people born in the 70s doesn't mean you would find the same results if you did it with people born in the 2010s, right? There might be cross-generational effects that you make your results limited to a particular generation. Longitudinal studies also, they take as long as people are aging, right? So if you want to look at the effects of growing up, you have to let people grow up. So longitudinal designs are frequently problematic in the sense that, like, if you're a researcher trying to be productive and publish things, to do a longitudinal design is basically saying, okay, I want to look over 10 years, so I'm not going to publish anything for 10 years. Okay. Which is a good thing to do because it's a useful type of design, but it's also kind of a selfless thing to do because, you know, a researcher that starts like a panel study that's going to last 30 years, like they might retire or not survive long enough to see the fruits of their labors. So it's often kind of a cross-generational sort of project where researchers are mentoring people to take over their roles eventually. So it takes forever. There also are problems with the sample, right? That people are not always going to respond to surveys over and over and over again for decades, and some of the people in your study might pass away themselves or become unable to reply. So these types of things we talked about at different points in the semester are definitely true for longitudinal studies. These last three things have to do with participants, being aware of or being affected by being studied. Practice effects, like, if you're giving somebody the same sort of cognitive test every 5 years for 40 years, they're going to get better at it. And it might not be because they're actually getting smarter. It might just be because they're used to doing that test, right? Or if you're giving people a score on a battery for depression. Maybe participants remember how they answered these things 1 or 5 years ago, and they don't want to look inconsistent, or they don't want to change their social attitudes, even though they feel differently. Maybe they just say they don't support welfare because they know they've said that before. People can try to appear consistent in order not to be embarrassed or just seem willy-nilly about things over time. Very distracted by the fact that I said willy-nilly when I'm talking about cross-generational effects, because who younger than 60 says willy-nilly? Anyway, the last one, reactivity, that we've talked about here and there too, that of course has to do with just being studied, being aware that you're being studied, and how especially people that are studied over and over and over again might be kind of affected by the experience of being studied, basically. Okay, last thing I want to talk about is that, cross-sectional designs have their issues because they are comparing separate groups of people at different times. Longitudinal designs have problems because they're comparing the same group of people over time. But you can combine these things into something called the sequential method, where you're doing both cross-sectional and longitudinal designs concurrently. So If you look at this, if you look across the rows, you have like separate longitudinal designs where you're following people born in the 70s, following people born in the 80s, following people born in the 90s, and in the columns you have cross-sectional designs where in 1995 you're comparing people that are 25 to people that are 15 to people that are 5. In 2025, you're comparing people that are 55 to people that are 45 to people that are 35 to people that are 25. So you have all these designs like kind of overlapping with each other. And if you do all of this at the same time, you can really tease apart the effects of the cross sections to the effects of the longitudinal parts. And you can make really complex statistical comparisons to show that something really is due to aging and not due to just a cross-generational issue or a cohort issue. The only problem with these things is that although they have all of the benefits of cross-sectional and longitudinal designs, plus some added benefits of being able to actually pull aging out of the equation, they also have an enormous logistical and financial cost of doing these. That you're not just doing one longitudinal design, you're doing 4. And you're not just doing one cross-sectional comparison, you're making a bunch of different ones. So you're basically doing, in this instance, a longitudinal study that's 4 times as expensive and time-consuming, right? So this is kind of a gold standard, but this is very, very rare that people have the time and resources and foresight to do a study like this. So again, this is probably the best way to do it, but it's a pretty rare study to see. Okay, so that's going to wrap up longitudinal designs as well. Remember, our exam is on Friday, April 3rd. It'll be through Canvas. Again, let me know if you're having problems or issues, any last-minute questions. I'm available through email. We could Zoom or talk on the phone if you find that more helpful. But do get in touch, and I will be around to answer any of those questions. All right.